Hi, I'm Bill Laveris. I'm the Content Director for the Mobile Enterprise 360 site. And I'm very happy today to be joined by Mark Farrow, who is CIO and VP of Hamilton Health Sciences. Mark, thank you very much for being my guest here this morning.
Thank you, Bill.
So let me get started by telling us a little bit about Hamilton Health Sciences and tell us about your role there.
Well, Hamilton Health Sciences is a family of 6 hospitals plus a cancer center in Hamilton, Ontario, Canada. We are an academic teaching center. We've got approximately 11,000 employees, 1,500 plus physicians, and very busy, multiple emergency departments, multiple specialty areas. And we see about 22,000 students a year as part of our academic training program.
Wow, so 11,000.
My role, it's a big organization. We're one of the largest employers in the region. And my role as Vice President and Chief Information Officer is to ensure that we've got the right strategy around information technologies. I cover all of the technologies from the IT side through clinical informatics into biomedical engineering. So trying to ensure that the whole spectrum is all brought together and that we can provide the right direction that we need to for our staff as we move forward.
Mm-hmm. And of course, yours is an environment, patient care, medical hospitals and whatnot, that is one of the more dynamic areas of information technology today. So let's, in that sense, cut to the chase and talk about what the relationship is in your mind between information technology today and the ultimate goal of improving patient care, improving patient outcomes, and of course serving physicians.
Well, I think it's absolutely critical now. 5 years ago or even less, while we were spending a lot of money on information technology, we were really doing all of it in the back end. And today, all of that's moved to the bedside. And so we are now seeing much more of the technology requirements to be at the immediate need to have it there at the bedside. It's all real time, and we're actually finally putting the tools in place that our nurses and physicians are using that information rather than going back to a paper chart. And so we've gone to full online documentation for our nursing staff. We're moving that way with our physician staff. We've ensured that our physicians have the ability to use any tool, anytime, to get access to the chart. And we ensure that all of the information is part of that and is available online. So it's become much more dynamic, and IT is really now the driver to that, where in the past, we were a little on the sidelines, and so I don't think any organization today can move forward without a solid IT strategy, and as part of that, you have to have a mobile strategy, because we're no longer at a desk. Very few of our staff spend their days sitting behind a desk, behind a computer. They're on the floors, they're in the treatment rooms, they're in the emergency department. And that's really changed the dynamics on how IT has had to look at this and how we've had to start to offer our services up.
Mm-hmm. Yeah, and as someone who's had a recent excursion through the healthcare system here in the United States, it really is extraordinary, the amount of technology at the point of attack, so to speak. And all the doctors and all the nurses, they're all carrying smartphones there. Many of them are carrying tablets and so forth. So I understand clearly what you're saying there about a mobility strategy. Now, Hamilton, I know, was invested pretty heavily in desktop virtualization and in several solutions that you've worked out with Citrix. Why desktop virtualization for the Hamilton Healthcare, and why the particular Citrix solutions that you chose?
Well, we went this way because, one, we're heavily regulated as far as ensuring we've got privacy controls and data security, and we wanted to be able to ensure we had that security for our staff and our patients while providing those solutions where our staff needed it. And as you mentioned, our staff are now bringing in smartphones and bringing in tablets. And, when we started down this journey, we felt that we could no longer be dictating to physicians what device they carry. Because in the past, IT always used to say, if it wasn't an ABC brand with this software and this on it, you can't connect into our network. And that's just not reality anymore. Physicians finally went from not wanting to use technology to having technology in their hands. And so we prepared ourselves, and we found that the Citrix product line with Zen App and Zen Desktop, using things like NetScaler to provide that consistent experience across devices was much more optimal for our physicians and our clinicians. And at the same time, we were protecting all of our data in the back end so that we weren't leaving a footprint on a device that we may not have provided for that user or secured. We were actually providing all of that security in the back end. And so this combination has provided a really great way for us to be able to, almost by happenstance, put all of this technology in the hands of our users that need it, while providing all of that security in the back end. And it's worked really well for us.
Mm-hmm. And of course, that's really the key to surviving in this era of consumerization of IT and BYOD, isn't it? Being able to protect the data that you need to protect and at the same time create the user experience that they demand.
Well, absolutely. And I think it's interesting because, if I look back on my career, what used to be an entire data center is now in my pocket. And if I take that and multiply it by the 11,000 staff that we have, that's almost like 11,000 data centers from the past. Why aren't we using that? And that's why I think that every healthcare organization needs to have that mobile strategy as part of their IT strategy, and they need to be looking for tools that will provide that for them. And we've been very fortunate in being able to find the Citrix line of Zen products, which has done just that for us, and has made us look really good in the eyes of our end users, rather than sort of those that are always lagging behind. And so we've been very fortunate, but it's been through partnerships with companies like Citrix that have made that happen for us.
Mm-hmm. Well, obviously you and your team are doing a great job over there at Hamilton. Mark Farrow, CIO and VP of Hamilton Health Sciences, thanks very much for that information, and terrific having you here today.
Thank you very much, Bill.
And I'm Bill Laberis for IDG saying thank you very much for joining us here today as well.